Let's be honest. Us men, we don't like to be vulnerable. We like to be strong, resilient, and invincible. And I'll be the first to admit, including me, even as a doctor, sometimes I have a feeling I can push through almost anything. But there is a difference between being strong and tough and between being blind. If we ignore these specific warning signs of prostate cancer, the consequences and price to pay may be severe. I'm Dr. Chovanec, and I'm a professor of oncology who treats prostate cancer. But I'm also a man who understands the hesitation. My mission with this channel is to replace fear and uncertainty with clarity and knowledge. In this video, I'm going to walk you through 5 changes that may happen to our bodies throughout the lifetime that we absolutely cannot afford to ignore, you and me. Prostate is this little organ that has a sponge-like structure. It's as big as a walnut and it's located just below our urinary bladder. All of us have it who are men, and it tends to grow larger with the age. So some of these symptoms we're going to talk right now can be misinterpreted between prostate cancer and benign prostatic hyperplasia, which is just a fancy word to say that the prostate is growing. The sign number 1 is increased difficulty passing urine, increased frequency of urination, especially during the night. If you find yourself waking up during the night to do those bathroom runs, this could be once or twice, even more frequently, and this is happening around the age of 40, this may be a sign of enlarging prostate, also a sign of prostate cancer. The symptom number 2 you may experience is burning during the urination or feeling pain during the urination. This could be a sign of urinary tract infection, so it may just be a bacteria that you can treat with antibiotics, and it's fairly easy to diagnose. But it can also mean this could be a more severe symptom and there is cancer hidden somewhere in there. In fact, if we look at this study done in Norway on 21,000 men, those men who had severe symptoms of urinary tract infection had more than double the chance of having a prostate cancer. And if we dig deeper into these numbers, we can see that men with severe symptoms of urinary tract infection had a 4.6 higher chance of having localized prostate cancer. That means prostate cancer only in the prostate. The sign number 3 is quite rare, but it can happen. Seeing the blood in your urine, which is called hematuria, or blood in your sperm, which is called hematospermia, may be a sign of damage or irritation to your urinary tract. This may not mean that you have a cancer, but there's a chance you may as well have. A meta-analysis of 65 studies have found that men with visible blood in their urine had increased risk of prostate cancer. While this risk was relatively low, about 6% of those men had prostate cancer, this is the sign to go visit your doctor. There are also signs of so-called advanced disease. Prostate cancer is a disease that can go and try to travel throughout our bodies. It can expand, it can try to go and find a way to set up that new colony, which is called metastases. Cancer cells can literally travel through the lymph vessels into the lymph nodes and then further away. Those are the little glands that look like little beans. We all have them in our bodies. They're designed to deal with the infection or with some stressful inflammation and then react to that. They're also designed to catch the tumor cells and try to fight with them, which sometimes they fail and they grow as metastases. If cancer cells use the bloodstream, you can find them in the organs, just like lungs, liver, or bone. And having bone metastases is very common in prostate cancer. So those are the lesions that are set up by the cancer originally from the prostate, and they're just painful. A lot of times you're gonna feel pain in your lumbar region, thoracic region, so this is where your chest spine is, or any other bone that you have in your body. Most of the time, those are the large bones. Sometimes you can have swelling in your legs or in your pelvic region. Sometimes even your scrotum can swell. This is the sign of really enlarging lymph nodes in the pelvis. So if you ever experience those, this is the urgent warning to go see the doctors, even in the emergency room. Let's call this a critical call to action for men. If we experience any of these symptoms, we have that take charge attitude. That is a manly thing to do, is to seek out the help. It's to seek out the opinion of the doctor. In this case, we need the urologist. If we discover prostate cancer soon enough, only located in that prostate, your chance to living through 5 years and beyond is 100%. If we feel shy, if we feel like nothing can happen to me, and I ignore those symptoms long enough, the price to pay may be lost life. And this is not only about me, this is also about my family, my partner, potentially kids. So if we want to live good and healthy lives, even with prostate cancer, this is doable. So there we have it. You now have the knowledge to recognize the symptoms that matter. Your mission now is to be responsible to you, is to be able to find help if you really need it, and to share this information with the men in your neighborhood, in your surroundings, with your friends and family, to help them out if they have problems on their own. I recommend you watch my next video on your list, 5 things no one tells you about life after cancer. This is where we focus on survivorship, the critical phase of recovery after cancer. If this video helped you find clarity, please subscribe. I'm happy you are here and I'm here to help.